at Watchung Pediatrics. Today, our wonderful team will answer some of the more common questions you may have about our practice. We understand that finding the best pediatric practice for your child is one of the most important decisions you will make as a parent, which is why we are here to support you on this journey. After watching this video, we encourage you to call our office and schedule a telemedicine appointment to meet with me or one of the other providers at Watchung Pediatrics. During that meeting, you can ask us any questions about your upcoming delivery or how to care for your new baby. We hope you find this video informative. We look forward to seeing you soon.
At Watchung Pediatrics, we truly believe in the science behind vaccines, and that by vaccinating our children and adolescents, we're preventing them from acquiring life-threatening diseases. This is probably the most important service that we offer. We follow the AAP and CDC guidelines for vaccine administration and recommend that vaccines be given within an acceptable window of time. For more information on our detailed vaccine policy, please visit our website at watchungpediatrics.com. Of course, we're always available if you have any questions or concerns regarding vaccines.
Hi, I'm Dr. Stacy Thompson, and I'm here to talk about which hospitals we admit to and what happens to your baby at the hospital. We admit to both St. Barnabas in Livingston and Overlook Hospital in Summit. All you need to know if you're delivering at those hospitals is to just tell them that Watchung Pediatrics is your pediatrician and the hospital will take care of everything else. They'll call us and one of the doctors from the practice will be in the next morning to see your baby. Every day that you're in the hospital, we'll come in the morning, examine the baby, and talk to you. On the day of delivery, we'll let you know when to come in, and it's usually 2 days after delivery that we want your baby seen in the office. If you're delivering at a hospital that we don't admit to, just give us a call on the day of discharge and we'll make an appointment for your baby to be seen 2 days later. And what happens to the baby in the hospital right away after delivery, the baby's going to get antibiotic ointment in their eyes, an injection of vitamin K, and a hepatitis B vaccine, and we agree with all those interventions. In addition, baby's going to get tested for, have a hearing test, a test for congenital heart disease, a blood test for bilirubin or jaundice, and also a test for the newborn state genetic screening. That genetic screening won't come back until at least a 2-week visit.
After hospital discharge, we'll see your baby within 48 to 72 hours, and then there'll be a 2-week visit, 1-month visit, and then slowly space them out. If there are other concerns, we will see your baby more frequently in between. At these visits, we'll see how your baby's growing, developing, discuss any issues or concerns that you have, do a thorough exam, and provide anticipatory guidance for the next visit. If you have any questions, don't hesitate to ask us at any time. Anything that's important to you about the baby is important to us.
We're available to you after hours and on weekends. For medical emergencies, please call 911. For other urgent issues after hours between 6 p.m. and 6 a.m., you can call our office answering service. The number is 908-251-9038. You'll reach the on-call service who'll forward your message to the on-call provider who'll return your call. You can also use our website's Page My Doctor feature as well. On Saturdays, the Warren and Milburn offices are also open from 9 to 12 for scheduled appointments only. We do schedule checkups and appointments for sick visits or acute illnesses as well.
All our providers participate in the same insurance plans. If we participate in your plan, no matter which location you go to or who you see, the visit will be processed the same. It is important to note all insurance companies require you to bring your insurance card for every visit. Please visit our website to see the list of insurance plans we participate in.
We're happy to announce that we do offer walk-in hours at all 3 of our locations. These visits are for established patients only with acute symptoms in the past 2 to 3 days. For more information, such as designated walk-in hours, please visit our website for more information.
We have a team of dietitians who will help you and your family achieve positive lifestyle changes through a personalized nutrition care plan based on your specific goals and health concerns. Nutrition counseling services provided by our dietitians include food intake analysis, medical nutrition therapy, nutrition education on disease prevention, weight management, meal planning, education reading nutrition facts labels, management of food allergies and intolerances, guidance on starting complementary foods with your baby, and more.
Hi, my name is Elaine Tampon, and I'm a pediatrician and certified lactation counselor here at Watchung Pediatrics. As a new mom, I know how overwhelming and difficult it could be breastfeeding. That's why here at Watchung Pediatrics, our goal is to provide evidence-based lactation counseling to our families during well visits and consults in order to help you achieve your breastfeeding goals. During our visits, we'll focus on latch, supply, nipple care, and pumping. If you're interested in our lactation services, please let our front desk know as you're scheduling your newborn visit, and they'll be more than happy to connect you with one of our lactation providers.
Hi, my name is Karen Morley, and I am one of the clinical social workers at Watchung Pediatrics. Watchung Pediatrics has been the first practice in New Jersey to earn the National Committee on Quality Assurance's distinction as having behavioral health integration. Integrated behavioral health care is a practice where your medical providers are here and they have mental health providers in the office to partner with your doctor and talk about what solutions you need. What happens in Watchung Pediatrics is that first, if you have a mental health concern, you bring that up to your medical provider. The medical provider will then engage the behavioral health provider to be part of your team. We will have maybe an appointment with you for an evaluation or conversations with you about the issue, and then we can either see you in-house for short-term therapy or use our expertise to connect you to providers and experts in the field in our community.
Hi, I'm Dr. Andrea Ploshnik. When signing into your child's patient portal, you can easily communicate with your child's provider, look at visit notes, growth charts, vaccine records, and much more. Although this tool is designed to be a convenient resource for our patients, it should not take the place of any important communications about your care. We continue to encourage you to call our office as necessary.
Our nurses and providers work on health forms and prescription refills every day. We are happy to complete forms for you, but please be aware that our regular turnaround time is 3 to 5 business days. There is an expedited form charge for patients who need their forms completed on an urgent basis. Please keep in mind that in order for a school form to be completed, your child must be up to date on his or her well child visit.
Prescription refills vary according to the specific medication or health condition. Most are prescribed electronically, including controlled substances such as medications for ADHD. Please give us at least a week's notice prior to the medication running out so we can prepare the prescription and have it ready to be picked up or sent over to the pharmacy. It is also required for some controlled substances that visits be made with your provider every 3 months. Please be sure to schedule the follow-up appointments before the medications run out.